Assalamu alaikum. It's a great pleasure to participate in this meeting with the groups interested in the health and diabetes, particularly during Ramadan fasting. And it's my pleasure to share with you the preliminary results of the 2024 DAR survey on physician perceptions of GLP1 receptor agonists and SGLT2 inhibitors during Ramadan that we have done just recently. And I'm presenting these data on behalf of Dr. Mohammed Hassanain and Dr. Beshyah Effendi and myself. None of us had any disclosures to make in relationship to this presentation. And by way of introduction, I would like to reiterate that since their inception, the GLP1 receptor agonists and SGLT2 therapy agents has been increasingly in use and expanding, partly due to their beneficial effects beyond the glycemic control, over and above the effects on glycemic control. Their efficacy and safety since they were introduced has been tested in several observational and controlled studies, and these led to the development of a consensus statement by experts upon which the guidelines were based to support their use. However, how widely are these guidelines translated in clinical practice, and how confident are people in the forefront of clinical practice are using them has not been well documented recently. We had initial surveys many years ago, but I think how this has evolved to the current day has not been documented recently. So therefore, the primary objective of our study was to explore the physicians' perceptions and practices in relationship to their access and usage of these two classes, the dosing practices around Ramadan and before Ramadan, and then how they do counsel the patients. The methods was straightforward SurveyMonkey exercise over a period of 2 to 3 weeks, ending at by the end of December 2024, mostly in the form of multiple choice questions that was formed by and deliberated by the 3 authors before we launched the general use. The sample was convenience sampling for a large number based mostly on the database of the DAR email list. For the current presentation, I'll be limiting myself to the descriptive analysis. We hope to do more in-depth analysis for the future. The outlines of the results, firstly, to establish the relevance of the respondents by presenting their demographic and professional profiles and their access and availability of these medications. And then I'll move to their perceptions and practices regarding the 2 classes of the medications. Now, over 1/3 of the people who responded resided in the Gulf area, about 13% in the rest of the Middle East, 16% in North Africa, and about 14% from Southeast Asia. So all of these are Muslim majority populations. We had also responses from Sub-Saharan Africa, Asia and Pacific, and Europe. The specialties were mainly endocrinology, around 41%, about a quarter were primary care or family medicine, about 1 in 5 internal medicine. There is a very small number of cardiology, nephrology, and other specialties. The practice setting are mostly public services, half of these responders, just over a quarter in private, and about 1 in 5 will actually practice in the two settings. People with type 2 diabetes that are seen by the physicians per month who are likely to fast during Ramadan, in about 2/3, just less than 2/3, you have a substantial number, more than 50 people per month, and actually even more than a quarter, they had more than 100. A smaller proportion had less than 10 patients per month who are likely to fast, but it's also they represent a small number of less than 10%. The borderline group is those who stated that they are seeing less than 50 patients. So they were a quarter of the responders. The availability, we made two questions, one in general and one specifically for the SGLT21 inhibitors. If you look at the general question, about 2/3, or just over 2/3, had readily available medications for routine use, and 1/3 have limited use. But those who had no availability are now very, very limited. When we ask specifically about the SGLT2 inhibitors, the availability was actually much higher, or almost 4/5 almost of the responders had routine access, and just over 20% had limited access. So we'll move now to the perceptions, and we'll start first by showing the data on the GLP1 receptor agonists. So the question, when do you initiate the GLP1 receptor agonists before Ramadan? The majority, about 50%, they will allow more than 4 weeks before Ramadan. Whereas about a quarter, about 1/5, the first 1/4 do not initiate the medication close to Ramadan. About 1/5 they can actually even do it before 2 to 4 weeks. Titration, just under half of the responders stated that they will follow the standard titration schedule during Ramadan, whereas 1/4 said they slow down the titration, and another quarter said they will delay the titration until after fasting. The dosing, 70% will maintain the same dose, 25% will reduce the dose, and just a small number will actually stop the medication temporarily. Regarding their preferred time, it was between iftar time and any other time during the non-fasting hours. About half will recommend the patient to take it with iftar time. About just over 1/3 will recommend any other time during fasting, during non-fasting time hours. The counseling was mainly in relationship to the GI side effects, nausea and vomiting, although some others also mentioned dehydration, dizziness, timing of the injection, and less than 1 in 5 say there are no specific counseling, and then there's no need to frighten the patients. The management was mostly by reducing the dose or stopping the medication by over half of the patients. If patients had experienced worsening of nausea or vomiting during their use of GLP1 receptor agonists during Ramadan. Whereas nutritional instructions, medical treatment, and stopping temporary has also been employed by other people. Regarding the SGLT therapy inhibitors, the initiation question by more than 4 weeks before Ramadan by about 47%. The remainder were divided between 2 to 4 weeks and less than 2 weeks, and about 22% said they don't initiate it during close to Ramadan. The initiation during Ramadan, majority will actually avoid that. 53% who said they will not initiate it during Ramadan, although others actually said yes, they can do it occasionally and whenever it indicated. The typical dosing was maintaining the current dose with no attempt to increase the dose by nearly 3/4. 22% will reduce the dose, and a small proportion, 5% or so, will stop the medication during the fasting. The timing, similar to GLP1 receptor agonists, 72% during with the fasting, and others actually between suhoor time or another time in the non-fasting hours. The counseling has mainly concentrated on the risk of dehydration and dizziness by over 80%, whereas others also mentioned the need for regular glucose monitoring, avoiding excessive exercise, risk of urinary tract infection, and risk of genital infection, but these are smaller in proportion compared with the emphasis on dehydration and dizziness. The primary strategy for prevention dehydration was to emphasize the hydration during the non-fasting hours, although others they have suggested things related to the dosing or holding the medication during Ramadan or attending to the presence of any other diuretic or diuresis-like medications. So in summary, most of the respondents that we have surveyed are from the MENA region and Southeast Asia. Endocrinologists represented more than 40%. Most had good exposure to potential patients. The access to GLP1 receptor agonists and the SGLT2 inhibitors is generally available with less limitations reported on the SGLT2 inhibitors. A high level of reservation is observed by the respondents, both the initiation and the titration of these two classes during Ramadan and nearer to Ramadan. We attempted to do some preliminary assessment of the endocrinologist versus non-endocrinologist, and I can say that we have noted some similar access in both groups of physicians. And there are some differences in the prescribing practices between them that warrants further investigation. However, both groups observe safety measures adequately. Thank you very much. I would like to, in the last 1 minute, just to bring your attention to the journals that I'm interested in, the Journal of Diabetes and Endocrinology Endocrine Practice, and the Ibn Sina Journal of Medicine and Biomedical Sciences. Please keep your manuscripts coming. Thank you very much. Assalamu alaikum.